Hi guys, welcome to my channel all about nursing. Today's topic is drug dosage calculations for oral medication. We're going to do 5 examples and we're going to work through it together using the formulas on the board behind me. Dose desired divided by dose on hand equals to the amount we give. So it means you take the dose, which is going to be the ordered dose that is desired. So we have an example. Our first example is going to be our patient was prescribed to have 500 milligrams of a medication and available on hand is 250 milligrams. So our dose desired is 500 milligrams. Our dose on hand is 250 milligrams equals to X. X is our amount to give, right? So we are trying to figure out how are we going to know how much tablets or capsules I have to administer to give this patient the desired dose of 500 milligrams. So it's simple. As we say, we divide the dose desired by the dose on hand. So the dose desired is 500 milligrams. So we divide 500 milligrams by 250 milligrams. This equals to 2. So this patient has to get 2 tabs or capsule. Yeah? So dose desired divided by dose on hand equals to the amount to give. So 500 milligrams, which is our dose desired, divided by 250 milligrams equals to 2 tabs or 2 capsules, as our first example. Second example, our doctor prescribes 0.7 grams of a medication for our patient. So our dose desired is 0.75 grams. And what we want is that we need to know how the medication is available. So he wants us to give the patient 0.75 grams, but the tablet comes in milligrams. So this is where your unit of conversion table comes into play. You have to know how much milligrams make a gram, okay? So our dose on hand is 250 milligrams, okay? So we have 250 milligrams. And this is going to give us X. And remember, X is the amount to give, right? So we have 0.7 grams divided by 250 milligrams. Does that make sense to you? No. We have to transfer the grams into milligrams. How much milligrams make a gram? 1,000 milligrams make 1 gram, okay? So what we have to do to change this grams into milligrams, so we're going to put 0.75 grams multiplied by 1,000 is going to give us how much milligrams this patient has to get. Okay? So this is going to be 750 milligrams. Right? So now we can work it out. So now our desired dose is 750 milligrams. Our dose on hand is 250 milligrams. And we know to figure out X, we have to divide the desired amount by dose on hand, which is 250 milligrams, equal to 3 tabs or capsule. Does that make sense? 3 tabs or capsule, because 250 milligrams into 750 milligrams is equals to 3. So we are knowing that we're going to get 3 tabs. It's going to give this patient 750 milligrams or 0.75 gram as the doctor wrote the order. Okay? Let's go on to the next example. For the next example, a child is prescribed a liquid medication at a dose of 15 milligrams per kg per day. Ooh, this one looks nice. Into 3 doses per day. The child weighs 20 kg. What is the dose per administration? All right, so let us talk about that. How are we going to calculate this one? All right, so our order is, what is our desired dose? We need to figure out that, right? So this child is weighing 20 kgs. So the child weight is 20 kgs. All right. So our child's weight is 20 kgs. our medication is 15 milligrams per kg per day. All right, so this is what the parts that we have so far. The child weighs 20 kilograms. The order is 15 milligrams for every kg per day. We are to divide this dose into 3 doses for the day. So it's supposed to be 3 doses for the day. All right, so now we want to work out how would we calculate this for this child. How are we going to know how we're going to work this out? So all right, we have 15 milligram per kg per day, so it means we have 20 kgs. So we're going to have to say 15 milligrams multiplied by 20 will give us this first part of the equation, right? So 15 milligrams multiplied by 20 is going to be 300 milligrams per day. So this child has to get 300 milligrams per day. So we solved the first half of the equation. We wanted to figure out how much milligrams per day the child had to get. So the order is 15 milligrams for every kg that this child weighs. So this child weighs 20 kgs. So this means it's going to be 15 multiplied by 20. That is going to give us the overall how much the patient is getting in one day. Okay? Now, the other part of the equation is the patient has to get this 3 doses for one day. So we have to divide this by 3 equals the child is getting 100 milligrams 3 times daily. Because we divide 300 milligrams by 3, it gives us 100 milligrams. All right? So again, the order is 15 milligrams per kg per day by 3 doses for the day. Child weight is 20 kgs. What we do, we solve the front part of the equation. How much milligrams do we have to give this patient in one day? Let's find out that first. So 15 milligrams multiplied by the amount of kgs this child weighs, and it brings us to 300 milligrams. So 300 milligrams in one day. We need to find out how much 3 doses. So equally, we divide in the how much we get for the day by 3, which is 300 milligrams divided by 3 makes 100 milligrams 3 times daily. All right, that's how we work that one out. That's our third. Now we have a patient is prescribed medication at 2 milligrams. So we have 2 milligrams of whatever the medication is. 2 milligrams per kg twice daily. All right. How much does this patient weigh? Our patient's weight is 60 kgs is the patient's weight. All right. So remember in the last one we did, we had to work out the front part of the equation. Okay. So we need to find out how much it's going to be. So what we do again is 2 milligrams for every kg this patient weighs. That's what this equation means. All right. So you have to say 2 milligrams multiplied by the 60 kgs because every 2 milligrams is for 1 kg. Our patient is weighing 60. So 2 milligrams multiplied by 60 equals to 120 milligrams per day. Now the order is twice daily. So what are we going to do? We have to divide the amount we have for the day by 2 because it's twice daily. So this is going to be 60 milligrams twice daily. All right. So the order was medication is prescribed for this patient 2 milligrams per kg twice daily. All right. Our patient's weight is 60 kgs. We have to find out how much milligrams we have to give this patient in one day. To do that, you have to take the 2 milligrams and multiply it by the amount of weight in kgs that the patient is currently at. Our patient is 60 kgs. So 2 milligrams multiplied by the 60 equals to 120 for 1 day. We want to know it's twice daily. We have to give this medication twice daily. So we have to divide the total amount for the day by 2, which will bring us to 60 milligrams twice daily. And for our number 5 example, so number 5, our 5th example that we will be working out together today. So our scenario is an adult patient needs a dose of 1.2 grams of medication. So that's our desired dose, okay? So again, desired dose equals, our desired dose is 1.2 grams, okay? Our medication is available as a liquid. It's with a concentration of 200 milligrams per 5 mils. So that's our dose on hand, or dose available, okay? So dose available right now is 200 milligrams for every 5 mils of this medication, right? And we need to find out how much is this patient going to get in milliliters, okay? So the first thing we have to do is find out amount to give. We have to know, our goal is to find out the amount to give. Sorry. Let me say it so I wouldn't be moving too fast, which is X. Okay? So basically this is what our summary is going to look like. 1.2 grams divided by 200 milligrams per 5 mils equals X. This is a lot. This is going to intimidate anybody. So we have to break this down to make it so that we can work it out. You can't work this out like this. Alright? So first to begin, how much milligrams make a gram? 1,000. So we need to break this down into milligrams, because that's what we have the medication available as, okay? So we have 1.2 grams multiplied by 1,000, because 1,000 milligrams equals 1 gram, okay? Which is going to give us 1,200 milligrams. So now the summary, our question is starting to make sense. So now we can say our summary, our sum is going to be that we have to work out 1,200 milligrams going to be divided by the 200 milligrams that is in every 5 mils. Okay? Now look at this. So every 5 mil is giving us 200 milligrams. When we break down how much milligrams in a gram, which is 1,000 milligrams equals to a gram. Now we need to know how much is 1.2 grams as a milligram. So 1.2 grams as a milligram means we have to multiply 1.2 by 1,000, which will give us 1,200 milligrams. Alright? Now we have to bring the equation to make it workable. 1,200 milligrams is dose desired. Alright? This is dose on hand. Yes? So we have to divide, as we know in our formula, dose desired is divided by the dose we have available or on hand. So 1,200 divided by 200 milligrams is going to give us 6 milligrams. And we know we have to multiply that by the 5, because why? 200 milligrams multiplied by 200 milligrams is in 5 mils, right? And we need to give our patient 1.2, so we changed everything. We come now and we find out we need to give our patient 30 mils, because 6 multiplied by 5 is going to give us 30. Alright? That is how we work it out. Or you just write it like this. Make it all simpler in your mind. We know it's 1,200 milligrams divided by dose on hand, 200 milligrams, and you multiply that by the 5 mils equals to X. Alright? Because 200 equals to 5, right? So we have here, it's going to be 30 at the end, because 1200 divided by 200 is 6 multiplied by 5 is going to give us 30. So X, the amount to give, is going to be 30 mils. Alright? And we know what 30 mils is giving us. 30 mils is giving us what? 30 mils is giving us 1200 milligrams. Okay? So that's how you work this out. When you have your order, you always follow our formula. And don't forget the formula. The formula is dose desired divided by dose on hand equals amount to give. Okay? So that was the 5 examples that we used to calculate some oral medication, liquid, tablets, and capsules. We apply it to make it come to make sense and be accurate and give our patients the accurate amount of medication that is ordered for the patient. So don't forget your formula. Your dose desired, always divided by your dose on hand, multiply that by a quantity, as in this example, when we have a proportion, as in 200 milligrams for every 5 mils, right? So if it is you are trying to figure out how we can make sure and understand these drug calculations, you have to practice. Practice, practice, practice. Because it's easy. Dose desired is divided by dose on hand equals to the amount to give. If we have a quantity, you multiply the dose, divide your dose desired by dose on hand, and you multiply that by a quantity, and you will get your answer. So I hope today that you understand this formula. I hope that it made sense. And look out for the next episode where we'll be talking about calculating IV medication. Thanks for looking out. Thanks for subscribing. Don't forget to click like and comment. See you next time.